proceed to another region, which is the arm, which is the arm. So let me first to explain on this model first. So here, this is the arm. So the arm in this model, the muscles of the arm are still intact. So if I will dissect skin and the superficial fascia, I will be faced immediately by this muscle that extends through the whole length of the arm. But don't forget that we have still a small part of this muscle that extends inside the axilla in order to form the lateral wall of the axilla. So here we have this muscle here. This muscle here, this is the biceps brachii. Biceps brachii that completely covers the anterior wall of the anterior compartment of the arm. And these are the two heads of the biceps brachii. This is the medial head, and this is the lateral head. Or this is the short head and the long head. So the short head lies medial, while the long head lies lateral. And characteristically, the short head of the biceps brachii originate with a common origin with this muscle. This is the coracobrachialis muscle that originate together with the short head of the biceps brachii, while this is the long head. Then if I need to retract the biceps brachii like this, I will be faced by the muscle that lies deep to the biceps brachii, and I can see only this muscle from its margin if the biceps brachii is intact. So that when the biceps brachii is intact, I can see this muscle lateral margin. This muscle is known as brachialis muscle. If I need to see the whole brachialis muscle, I can easily retract the biceps brachii like this in order to see this muscle, which is the brachialis muscle. And here, from the back, this muscle that lies in the back, all this muscle that I am holding, this is the triceps brachii. Let me to shift it to this model, separate model here. So again, so this is the pectoralis major muscle, two heads, the clavicular head and the sternocostal head. And this muscle, this is the deltoid muscle, and we have this groove here. This groove is known as a deltopectoral groove or infraclavicular fossa. And this muscle, this is the biceps brachii. When I will retract or reflect the pectoralis major, this is to demonstrate how the biceps, the short head of the biceps brachii originate in a common origin with this muscle. So this muscle is the coracobrachialis muscle, while this is the short head of the biceps brachii. And these two muscles originate by a common origin as mentioned here. This is the common origin for these two muscles, coracobrachialis and the short head of the biceps brachii. And here, this is the long head of the biceps brachii, and the two heads will fuse in order to form the main muscle. One of the funny questions which is frequently asked about Dr. Hassan, yes, here we can see this is the long head while this is the short head. One of the important findings during the dissection of the arm, that the long head appears short while the short appears long. Why? Because of the long head, so that you can compare between the length of these two heads. So the short head here appears longer than the long head. But actually the long head is long while the short is short. This is why, because of the part of the long head of the biceps brachii is covered by the capsule of the shoulder joint, which is completely hidden. And the long head appears only from this distance. But actually, long is long, while short is short. When I will proceed downward, now I will enter to this very important anatomical region, which is known as the cubital fossa. So this is the cubital fossa. And here this is the tendon. Yes. So this is the tendon of insertion of of the biceps brachii. Because of the biceps brachii has two insertions. It has a tendinous insertion, which is this one, and from the medial side of the tendon appears this flat sheet, which is known as bicipital aponeurosis. One of the important findings here in this cadaver, we have this structure. This vein is the median cubital vein that lies superficial. If I will dissect here, yes. So this is the bicipital, which is very thin. This is the bicipital aponeurosis. It is very thin, and it is so delicate that it can be easily injured. So this is the bicipital aponeurosis that originate from the medial side of the biceps tendon, and it will be merged with the deep fascia of the forearm. But here you must notice the relation between between this vein, which is the median cubital vein, and the bicipital aponeurosis. So this vein is the median cubital vein that lies superficial to the bicipital aponeurosis. This is why the median cubital vein, it is sometimes known as vein of injection. And this relation between the median cubital vein and the bicipital aponeurosis, in which median cubital vein lies superficial to the bicipital aponeurosis, it will protect the deeper structures that present in the cubital fossa. So let me to shift. So here in this model, the bicipital aponeurosis is partially removed. So what are the contents of the cubital fossa? So here first we have this tendon, which is the tendon. Make it here. Yes. This tendon is the tendon of the biceps. This tendon is the tendon of the biceps, and from its medial side originate the bicipital aponeurosis. Then we have this artery. This artery is the brachial artery, the termination of the brachial artery. So take care about the extension of this artery like this. So all this artery that runs here, this is the brachial artery, and the brachial artery divides into two arteries. So this artery here, this is the radial artery, and this one, as I will demonstrate later on, but I think it is torn here, is the ulnar artery. I think it is absent, but it is present in this specimen. And one of the very important structure that lies inside the cubital fossa, this nerve, which is this one, this nerve is the median. This nerve is the median nerve. So let me to demonstrate here. Yes. So here, this artery, this artery is the radial artery, and we have another artery that will appear here also. So here, these are the two arteries which form the terminal branches of the brachial artery that lies inside the cubital fossa. The artery that lies lateral, this is the thumb. So this artery is the radial artery, while this artery is the ulnar artery from their names. Then, so again, yes, here, this artery, yes, we have these two arteries. So the one artery that runs laterally and the another artery that runs medially. This artery is the radial artery because this is the thumb, while this is the ulnar artery, which form the two terminal branches of this one, which is the brachial artery. When this muscle is reflected, we will be faced by this muscle which is the brachialis muscle. And here notice that how this nerve, as I mentioned before, how this nerve supplies all the muscles of the anterior compartment of the arm, because we have here multiple branches, these multiple branches to supply this muscle, which is the coracobrachialis muscle, and it gives the biceps, and also it sandwiched between the biceps brachii and this muscle, which is the brachialis muscle. Then when we will tilt the arm like this, we will be back again to the posterior compartment of arm. And here in the posterior compartment of arm, it is occupied only by one muscle. This muscle is the triceps brachii muscle. And the triceps brachii has three heads. This head, which is the long head, while this head is the lateral head, and these two heads lie superficial. If I need to see the medial head, I must retract the long head and the lateral head in order to see the medial head. So take care that the medial head lies deep to these two heads of the triceps brachii. And sure, this tendon is the tendon of the biceps, is the tendon of the triceps, which is attached to this bone, which is the olecranon process. And don't forget also the relation between the long head of the triceps and the gateways, as I mentioned in the beginning of this video. So that here, in order to make the vision more clear, we have this space which is the triangular space that lies between teres minor, teres major, and the long head of the triceps, and it contains this small vessel which is the subscapularis, circumflex scapular artery. And then we have this space inside here, and I have to zoom in. So this is space inside, this is the quadrangular space. And in the quadrangular space, we have these two contents that form the contents of the quadrangular space. So this nerve is the axillary nerve, while this artery, this is the posterior circumflex humeral artery. And these are the boundaries of the quadrangular space. It is bounded medially by the long head, and it is bounded laterally. Here I can feel the bone of the surgical neck of the humerus, superiorly teres minor and inferiorly teres major. And here, if I will pass this probe inside, it will appear like this in the axilla. This is why this gate is known as the gate for the posterior wall of the axilla. And again, if I will introduce this is the upper triangular space. If I will introduce the probe from here, it will appear also. Yes, it will appear also inside the axle. And this space below, this is the triangular interval. So don't forget to take the probe here indicates the teres major muscle. So the space above the teres major lateral to the long head, it will be quadrangular space. And the space above the teres major medial to the long head, which is this one, this is the triangular space. And this is the triangular interval. How I can identify the triangular interval? As it lies below the teres major. So that in order to identify these gateways, I must first identify the teres major muscle. And here, as I mentioned, this is the long head of the triceps. This is the lateral head of the triceps. And all this bundle contains this nerve. If you can see this nerve here. This nerve is the radial nerve. This is the radial nerve. And these vessels inside, these are the posterior circumflex, this is the profunda brachii artery that runs in this space with the radial nerve. So that I hope that these three spaces are now becomes clear.